quick word about the Flipple or the nipple flick technique, which can be an absolute game changer for some people if you've been having nipple pain. It just helps to get the latch just that little bit deeper and to the back of the baby's mouth and to the soft palate. So rather than the baby coming on like this, we're actually folding the breast tissue up, so that you're creating a bump there, and that baby's bottom lip and tongue will be at the bottom of the bump, and when they open wide you flick the nipple down and in at the same time as you bring them forward, and that gets them on a lot deeper. So if they're coming from the front cross cradle position, for example, you would support your breast from underneath, fingers well out of the way because you're going to be trying to get a lot of that breast tissue in. Thumb on the edge of your areola there for most people, round about the edge of the areola, and you will pull back or press into the breast tissue, which, as you can see, angles your nipple immediately kind of to the side, creating that bump there, which is that bump you want to get into the baby's mouth. Tease their nose, wait for them to open really wide, and when they do open really wide, at the same time as you're flicking the nipple down and in, keeping that bottom lip down under there, flicking it down and in, bringing them forward at the same time, chin first, then you will get a much, much deeper latch. But it is a bit of a knack, and it does take a little bit of practice, the sort of the flick and pull in at the same time. But once you've sussed it, absolute game changer. The other thing, if you're finding your baby's not tipping their head back very well and that you're struggling with that, then you could do the koala hold, which is where you have them sitting on your lap, looking upwards towards the breast like this, and you can still do the Flipple. So you have your thumb on the top, fingers well out the way again, remember, and you push into the breast or actually kind of pull back to make that bump underneath there. Tease the baby's nose, and when they open up, you can flick the breast down and in at the same time as you bring them forward, chin first, and that gives you that really lovely, nice deep latch, which is just a much happier place to be. So let me know if the Flipple works for you, and let me know if this has helped.